name is Dr. Claudia Anderson from Family Dental Care Park Ridge, and welcome to another segment of Word of Mouth Wednesday. Today we're going to talk about dental fillings. When you've been told that you have a cavity in one of your teeth, you're going to need that tooth filled. The dentist is going to remove the decay from the tooth, clean the tooth up so that there's no more bacteria left that's causing the decay, and they're going to fill that tooth. The two most typical types of fillings that are used by dentists are amalgams or composite-based resins. Amalgams are the silver fillings that we're all pretty familiar with. Amalgam, the word amalgam actually means a mixture or a blend or combination. And in fact, that's what amalgams are. They're a mixture of some metals, silver, tin, mercury, zinc, and copper, that combine together and form kind of, when they're together, mixed together initially, they're quite a soft and moldable material. And so that material is placed into the hole where the cavity used to be, and now it's just a clean hole in your tooth. And the dentist pushes that amalgam in, gets it to fill every nook and cranny, and it creates a very stable, very predictable restoration. For years and years and years, it was really one of the only alternatives, and it was great because it was strong, it was stable, it created a healthy tooth for many, many years. Now we have composite-based resins that are as wonderful as amalgams and even better in that they're aesthetic. So this is what your typical tooth-colored filling is. So the composite-based resins are white, and they come in various shades now. Dentists have the luxury of being able to select the shade that's closest to your tooth's shade. They're perfect for front teeth fillings, so if you have a cavity on one of your front teeth, you certainly don't want to have metal up at the front. You don't want to have that gray shining through. So the composite-based resins with the many, many shade selection is a wonderful alternative. And in recent years, those composite-based resins have gotten better and better. The researchers and the scientists are working on this material all the time to make it a very viable restoration for the back teeth as well. Years ago, when composite-based resins first came out, they weren't quite as strong as the amalgams were, and so putting them in your back teeth wasn't necessarily a very good idea. They didn't last very long. Now composite-based resins are stronger. They have what we call flexural strength, meaning that they kind of bend with the tooth so that they don't crack or fracture. They bond to the tooth, creating a very, very tight connection between the tooth and the filling, decreasing the amount of bacteria that can enter in, and they're wonderful. So those are the two types of dental fillings that most dentists still use. Your dentist may prefer one or the other. There are certain situations where amalgams are still preferred because the composite-based resins require very specific and very intricate types of situations to use them. And what I mean by that is the area that you're working has to be very, very dry. And of course in our mouth that's a little bit difficult, so it's a challenge. So putting in a composite-based resin requires a lot more time, more effort in keeping the area very dry so that the bonded resin bonds well to the tooth, otherwise it won't stick very well. An amalgam, you can have a moisture environment, and so sometimes in an area where it's just impossible to get the area dry, you're going to have the dentist say that maybe we should put an amalgam in there. So there are pros and cons to both types of restorations. They both work very well, and that's what I wanted to share with you. If you have questions about amalgams, about composite-based resins, and you want more information, please feel free to give us a call at our office or email me at info@parkridgedds.com. I'd be happy to answer any of your questions. And that's what I wanted to talk about today, and remember, as always, we love making you smile.